Before walking into the patient's room, I would assess the door for any flags or markers such as contact precautions, fall precautions. Walk into the patient's room, perform hand hygiene, assess for any environmental hazards such as an IV pole in the way, trash on the floor. Hi, my name's Sarah. I'm going to be your nurse for the day.
Hi.
Can I see your name or your armband? Can you verify your name and date of birth for me?
Rebecca Pierce, 12-193.
Okay, perfect. And where are you today?
Johnston Willis Hospital.
And do you know what today's date is?
December 4th, 2016.
Okay, great. And on a pain scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you've ever felt in your life, are you in any pain right now?
0.
Okay, great. So patient appears to be fully conscious. Her facial expression is calm and relaxed. She's laying supine with the head of the bed elevated at about a 45-degree angle. Her skin color is appropriate to ethnicity. She's got good elastic skin turgor. There appears to be no speech or hearing deficits as she's answering my questions appropriately. She is dressed neat and clean and appropriately for the season. She is A&O times 3 to self, time, and place. And I'm just going to perform a quick pupil response for you, okay?
Okay.
Just follow my pen line. Alright, so pupils are at about 4 millimeters. They are round, reactive, and accommodating to light bilaterally. Do you mind swallowing for me? Do you have any pain or anything when you're doing that?
No.
So no dysphagia noted, no problem swallowing. I'm just going to perform a motor test, okay?
Okay.
Do you mind pushing your feet against my hands? And back up towards you. And one leg at a time, can you raise them up to your chest? Perfect. And can you squeeze your hands for me? My hands for me. And can you raise your arms above your head and back down? Great. So no motor or verbal deficits noted. Her upper and lower muscle strength is intact. She appears to have no weakness or anything in her extremities. Can you tell where I'm touching?
My shoulder.
What about now?
My hand.
What about now?
My knee.
And what about now?
My foot.
Alright, so good sensation in all extremities. No ptosis or facial drop noted. I'm just going to perform a respiratory assessment, okay?
Okay.
So no supplementary oxygen is in place. And if it was, I would assess the flow rate, the liters per minute, and if there are any kinks or tubing in the tubes or anything. Can you sit up for me? I'm just going to auscultate anteriorly and posteriorly. And every time you feel my stethoscope on your skin, just take a deep breath for me, okay?
Okay.
Alright, posterior. Alright, you can lay back down for me. So breath sounds are unlabored and symmetrical. Lung sounds were clear to auscultation. Do you mind taking a deep breath and coughing for me? Alright, so that is a good sounding, non-productive dry cough. She produced any mucus. I would assess for the color and amount of mucus. If she had any problems deep breathing, I would educate her on the use of an incentive spirometer. I'm just going to look at your extremities real quick.
Okay.
Alright. So, there appears to be no edema or swelling in the lower extremities. It's great. I'm going to palpate your posterior tibial pulses, your dorsal pedal pulses. Appears to be 2+ full and bounding. She has no IV in place. If she did, I would assess for any signs of skin breakdown, bruising around the site. Want to make sure that the fluid is going in properly. Can I see your fingers real quick? Perfect. Capillary refill is less than 2 seconds. And I'm just going to listen to some heart sounds real quick.
Okay.
So I'm going to listen to the apex of your heart. Regular sounds there. This is your apical pulse, the midclavicular line, 5th intercostal space. I'm going to palpate simultaneously with the radial pulse. No pulse deficits noted, that's great. I'm just going to listen to some heart valve sounds.
Okay.
Starting with the aortic, pulmonic, Burb's point, tricuspid, and mitral. Would repeat that with the bell. You have good communication skills. Everything is coherent, logical, speech is clear. It is wonderful. So, her skin appears to be warm and dry to the touch. Good elastic skin tone again. Skin color is appropriate to ethnicity. No lesions or dressings were noted. If they were, I would assess for any signs of infection from the dressing, if they needed to be changed. Any signs of skin breakdown, which none are noted. If she did have skin breakdown, I would assess the need for the Braden scale, which none is noted. Can you lift up your shirt for me? I'm just going to look at your abdomen. So everything seems to be flat and symmetrical, and I'm just going to auscultate your vowel sounds.
Okay.
Starting in the right lower quadrant. I'm going to move my way around. Alright, good active vowel sounds in all 4 quadrants. I'm just going to palpate real quick. Do you feel any pain or tenderness when I do this?
No.
Okay, great. You can put your shirt down for me. When was your last bowel movement?
Earlier this morning.
And do you ever have any diarrhea, constipation?
No.
Alright, so this lets me know that she's tolerating her diet well. Do you have any difficulties urinating making it to the bathroom in time?
No.
Any burning or pain when you urinate?
No.
Alright, that's great. And if she had a Foley, I would assess for the color, amount, and clarity of urine. But there's none present. She's not on any bed rest. If she was, I'd make sure the head of the bed was elevated. She's an assist type 0. She's pretty independent. She can transfer herself to and from the chair, so she is not a fall risk. She's pretty independent, so no risk or no need for a fall risk assessment tool. She has no SEDs, TEDs, or pumps in place. No use of ambulatory devices such as canes, walker. Again, she's very independent. Before I left the room, I would make sure the bed was in the lowest position, appropriate side rails were up, brakes were locked, and if she did have a bed alarm, I'd make sure that that was on. Make sure her call bell was in reach, and I'm going to leave to go document, and I'll come back and check on you shortly.
Okay, thank you.
Have a good one.